SAMFund, and with me is Michelle Zietler, our program director, and Monica Fawzy Bryant, who will be today's presenter, who I will tell you more about. A few just quick sort of housekeeping things before we get started. You'll notice on your screen that there's a box where you can type in questions. If during the presentation a question pops up or you need clarification on something, go ahead and type it into the box, and Michelle will be fielding questions during the presentation, and we'll present them to Monica at the end of the presentation. If your question happens not to get answered because we run out of time or whatever happens, Monica will do her best to answer questions in a blog post on their website, which also we'll tell you about after this webinar. So type them in as you think of them, and we will do our best to get to as many as possible. Also, on the very last slide at the end of this webinar, you'll see a link to a post-webinar survey. And we ask you to take a couple minutes to give us some feedback on today's presentation and on our webinar series as a whole. We really value your feedback and are constantly looking at the topics that we choose and how the information is presented, and just trying to make sure that it's as helpful to you as possible. So please take a couple minutes to give us that feedback. We really, really appreciate it. So okay, with all of those details aside, I want to welcome all of you, and especially welcome Monica to today's webinar. All of us know that cancer is an expensive disease, and among the many things that we've seen in its past, a lot of times it also can do some significant damage to our credit scores. And so today's webinar is really dedicated to figuring out how to rebuild that credit after cancer treatment, and either declaring bankruptcy or considering it, or learning about what the alternatives might be. So we're really, really excited to have Monica Bryant joining us again as our presenter for this webinar series. She's one of our most trusted partners and does incredible work in the cancer community. And she's a cancer rights attorney, a speaker, an author, and currently Chief Operating Officer for Triage Cancer, which is a nonprofit organization dedicated to providing education and resources on cancer survivorship issues. Previously, she served as the Midwest Regional Director for the Cancer Legal Resource Center. She's also an adjunct law professor at John Marshall School of Law in Chicago, teaching a class on cancer rights. She sits on the American Cancer Society's Women's Board and volunteers for the advocacy committees of the American Cancer Society Illinois Division and the Metropolitan Chicago Breast Cancer Task Force. So basically, she knows her stuff. She's got a whole lot of information to share. We are thrilled to welcome her today. Monica, thank you so much for being part of today's webinar.
Monica may be actually switching to her phone because we were getting a little bit of an echo when she was on her computer. So,
okay, so we'll just give it a couple minutes. For anyone also who either has to duck out a little bit early today, or if you know of somebody who wanted to participate that wasn't able to do it at this time frame, this webinar will be recorded, and it will be posted on our website as well as on our YouTube page. So you can download that at any time, share it far and wide with anyone you think might benefit from it. So we'll send out links to all of that. But if you check our website in the next couple of days, you will see a recording.
All right, I think Monica should be with us now.
I'm back.
Welcome back.
Thank
All right, Monica,
you.
I'm going to give you control of the screen here.
Perfect. So thank you so much for having me, the SAMFund, and thanks for all of you for joining us. Today we're going to talk a little bit about how to rebuild your financial health after a cancer diagnosis. I will be making some references to my organization, which is Triage Cancer. So just so that you know a little bit about what we do, we provide education and resources on all types of survivorship issues. And we do that in a couple of different ways. And perhaps most relevant to those of you on the phone is going to be our online information and resources, as well as our educational blog. So our website is just triagecancer.org. So hopefully you can all remember that and find some useful things on our website as well. Now, there are many factors that contribute to a feeling of financial instability, and perhaps the most obvious is going to be the high cost of treatment, which often translates into large medical bills. We know that having health insurance can make a huge difference in one's financial health, but even those that have health insurance policies may find that their policies don't cover as much as they thought they would. And prior to the Affordable Care Act, otherwise known as healthcare reform or Obamacare. Today we'll refer to it as the ACA. Prior to the ACA, once someone was diagnosed with cancer, it could be next to impossible to get health insurance in the individual market. Thanks to the ACA, as of January 1st of this year, insurance companies can no longer deny selling somebody a policy just because they've gotten sick. And also thanks to the ACA, there are now 10 categories of essential health benefits that all insurance plans must cover in order to be sold in the marketplaces. So the hope is that these two changes, along with several other positive benefits, will help people not only access health insurance, but also that the health insurance people have will cover more of what they need it to. But even having access to better quality health insurance will not completely solve the problem. And that's because there are often changes in one's employment status during and after treatment. So perhaps you had to take time off or leave your job entirely to get through treatment. Perhaps it's that you had to move to part-time. Either way, you're likely feeling that change in employment status in your wallet. And it can be next to impossible just to pay your monthly bills, let alone keep up with all of the extra medical costs. And finally, in addition to your cancer journey, you may have experienced some other life changes. Maybe you've finished school, maybe you've started or ended a relationship, maybe you've moved states. All of these life changes can also have an impact on your finances. So it's no wonder that so many cancer survivors have questions about finances. Hopefully today we're going to give you some answers to your questions, but before we move on to the practical tips on how to start building a foundation for a healthy financial future, we suggest that you start by reassessing your financial plan.
Hey, Monica, did you see, I know your slides are cutting off a little bit. I wonder if you wanted to switch over to my set.
No problem. What do you need me to do?
Switch back to me, and you just let me know when you need us to.
Next slide, please. Perfect.
Okay.
So even if you've had a financial plan prior to your cancer diagnosis, it can be helpful to review where you are financially after completing treatment. So figuring out what your financial picture looks like can help you decide which of the following steps that we're going to talk about today you should take, if any. And it can also help you identify priorities. So maybe your first priority is going to be finding a job. Maybe you're nowhere near that stage because you are someone that has to prioritize opening that stack of bills that you've been too afraid to open. Maybe you're in a place where you are through the deepest part of it and you're ready to start thinking about building your savings or contributing to a retirement plan. Figuring out your next steps, what your next steps might be, is going to be entirely personal to your situation. So just to sort of get you started, think about these questions. What's your current status of your finances? Were you able to keep working through treatment or did you need to take time off? Now that you've finished with treatment and you're back at work, were you able to go back to the same job or type of work? Or maybe because of side effects, you need to look for another career path. Do you have a stable income? Next slide, please. What are your current recurring and potential expenses? What assets do you have? And when we're talking about assets, we're talking about things like homes, savings bonds, retirement plans. And we're going to talk a little bit more about the ability to use these assets in different ways. You also need to think about what type of secured and unsecured debt you have. Now, so that we're all on the same page, secured debt is going to include things like car loans or home mortgages. Unsecured debt is going to include student loans, personal loans, and credit card debt. Now, once you have a sense of the answers to each of these questions, you can then move on to what steps you can take to improve your financial health. Next slide. So generally, the first step for most people is going to be checking your credit. If you've already had a challenging financial picture, then you may be less concerned about the drop in your credit score that will likely result from your working with debt solution agencies or filing for bankruptcy. However, you have to know what your credit score is and check your credit report. People are often surprised to learn that your credit can be checked when you rent an apartment, when you lease or buy a car, when you buy a home, or even when you get something like cable television. In addition, some potential employers may conduct background checks that include looking at your credit score or your entire credit report. So it's important for you to know exactly what's on that report so that you can be prepared to answer questions should they come up. Now, fortunately, of all the steps we're going to discuss today, this one might be the easiest to take. Each of the 3 national credit bureaus, so that's Equifax, Experian, and TransUnion, are required to provide you with a free copy of your credit report once every 12 months, but you have to ask for it. So to order a copy of your credit report, you can visit annualcreditreport.com or call this number and ask for your credit report. Once you receive your report, check to make sure that the information about you is correct. And if not, you can ask the credit bureaus to fix that information. So the information that you're going to want to look for is, are they showing accurate balances to any credit cards you have? Are there cards that you thought were closed that are showing open? And you may be surprised as to what you see on your credit report. So some people say to me, I never realized how many of those department store credit cards I opened until I looked at my credit report. So all of those things are going to matter, so make sure things are accurate. Now, a credit bureau is allowed to report your most accurate negative information for 7 years and bankruptcy information for 10 years. And while that may seem like a really long time, you may be able to use that timing to your advantage. For example, let's say you're trying to buy a car and you need a loan. But 6.5 years ago, you negotiated a settlement to close a credit card for less than you actually owe. That's going to be something that shows up negatively on your credit report and is going to lower your credit score. However, since it can only be reported for 7 years, it may be beneficial for you to wait that extra 6 months before getting the car loan so that that item is no longer on the report and you can perhaps get a better deal. Just so we know, the Federal Trade Commission, or the FTC, is the federal entity that deals with these types of issues and is a great source of information about credit scores and reporting. And their website is just www.ftc.gov. Next slide. After you've assessed your financial picture, including checking your credit report, the next step is likely going to be for you to create a budget. This budget should include all of the new information that you've gotten, including any expenses that you may have remaining related to your medical care. And it should project future expenses. And although we know that it can be challenging to project those future expenses, especially when it comes to medical care, there may be some ways to do this. So first, you can look back at old bills to get an idea of how much future care is going to cost. So if part of your follow-up care is going to be that you need an MRI every 6 months, and you've had an MRI in the past, you can actually go back and look at your old bills and budget out how much those 2 MRIs a year are going to likely cost you moving forward. If you want to create a budget on your own, please feel free to do that, but remember that you don't have to reinvent the wheel. There are literally thousands of free templates available online that you can download and customize as you need it. And then there's also some software options like Quicken or smartphone apps, because there is an app for that, that are going to be relatively inexpensive that can help you create budgets. Next slide. But many people might feel uncomfortable or overwhelmed with the idea of doing this kind of budget completely on their own. And we recognize that sometimes creating a budget isn't always as easy as it sounds. So sometimes you can be left feeling like this couple. This is a couple sitting at their kitchen table discussing their finances, and the husband says, well, sure, we can pay off our past and save for our future, as long as we avoid the present. So if you have similar sentiments, a financial planner may be the best option for you. Financial planners work with people of all income levels, so don't feel like you have to have what I call Steve Jobs type money to utilize one. If you are thinking about finding a financial planner, there's several different ways to go about this. Word of mouth, so ask your friends. You might be surprised as to how many people utilize financial planners. And you can also visit the National Financial Planning Association to find a planner in your area. Most planners will provide an initial consultation for free with absolutely no commitment, and some planners actually don't charge anything. You may also want to consider contacting a consumer credit counseling agency. So these agencies can provide you with practical tools such as financial calculators, more budget worksheets, and other types of resources. And they may also be useful if you need to negotiate payment plans or settlements with your creditors. But if you choose to go that route, we just like to remind people that many debt solutions, like negotiating payment plans or settlements, may negatively affect your credit. So this is going to be one of those personal decisions. Maybe you know that you're not going to be needing credit anytime soon because you already have your mortgage and a brand new car. So it might be smarter for you financially to reduce your debt and absorb that 7 to 10-year hit on your credit. But I urge you to talk about this with a professional before you make the decision. And for many young adults, this is particularly challenging because it's hard for us to anticipate where we're going to be in life in 7 to 10 years. Next slide. Now this leads me to the idea of rebuilding your credit. It can be challenging to raise your credit score if it drops, but it is possible. And also, just because you have a low credit score doesn't mean that you cannot get credit. Each creditor sets their own standards, and some may only look at your recent history. So if your bill paying history has improved, then they may offer you credit even if you have lots of outstanding debt. And it may be worthwhile for you to contact potential creditors informally to discuss their standards. So just like with anything else out there, if you are looking to get a credit card or another credit card, shop around because you are a consumer and you can be a smart consumer and try to get the best deal possible. There are also some other ways to build a better credit report, and that's generally about using your credit cards wisely. So for example, if you have more than one credit card, try to make sure that the balances on each card are not more than 75% of the available credit on that card. For example, if you have a card with a $5,000 limit, the maximum balance you're going to want to have on that card is going to be $3,750 because creditors will look at your debt to credit available ratio. And so the lower the amount that you have on those cards, the better it looks. There are also some general ways to demonstrate fiscal responsibility that have nothing to do with credit cards. So filing your taxes. Even if you can't pay the whole amount that's due, file your taxes and you can work out a payment plan with your state tax entity or the IRS. That's very, very common. Another way to show fiscal responsibility is by paying down your bills with the highest interest rate first. So you might want to say to yourself, well, I have all these bills and bill X has the highest balance, but bill Y has the highest interest rate. Shouldn't I reduce the balance? And it might be contrary to what you're thinking, but really what is recommended is paying down the bills with the highest interest rate first. You may also want to look into secured credit cards. So these are going to be credit cards that require you to put a certain amount of money into an account, and they will give you a credit card with that spending limit. And there's lots of credit card scams out there, so make sure that you go to a reputable institution, such as a large bank or a local credit union. So if you've never heard of the entity offering you a secured credit card, I would be wary. Avoid cards that have additional fees or that require you to buy insurance, because that's just more money coming out of your pocket every month. Now, this is also going to be challenging for some people who have just finished treatment, but think about building your savings. And you can do that by paying yourself each month first, even if it's a small amount. And again, this is going to be challenging and might seem counterintuitive to paying off bills. But remember, if you have no cash reserves and you're faced with another emergency, and that could be anything from an unexpected scan that you might need or an exploding water heater. If you don't have those cash reserves, you're probably going to end up going into deeper debt to try to deal with that emergency. So think about building your savings little by little. And finally, for many young adults, it might seem that retirement is way off in the future, but building your retirement assets is going to be important, especially if you've had to dip into your retirement plan while you were in treatment to help pay your bills. Oftentimes, you can contribute to your retirement plan on a pre-tax basis, and look into any sort of employer matching programs, because a lot of employers will match whatever contribution you use to your plan. So our thinking here is don't leave money on the table. Next slide, please. Now, if you've had a situation where you have creditors, try talking to them. And we suggest talking to them before they turn over your unpaid bills to collection agencies. This is something that can significantly protect your credit. So if you're in a situation where, excuse me, if you're in a situation where you can't make a payment, ask your creditors for more time. Remember, they want to get their money, so they're much more willing to give additional time than to send you to collections, because that costs money for them. Perhaps they would be willing to negotiate a payment plan or accept a lower lump sum payment. So when I'm talking about creditors in this context, I'm talking about credit card companies, your landlord, student loan companies, healthcare providers. You'd be surprised how flexible creditors can be, especially if they know that you faced a significant hardship like a cancer diagnosis. And here, our motto is, it can't hurt to try. Even if you make the effort to contact creditors and they're not willing to help you at all, when you hang up that phone, you're certainly not in any worse of a place than you were before you picked up the phone. Now again, one word of warning here is please be careful if you are considering paying your medical bills by credit cards. First of all, most credit cards have a very high interest rate, and you're going to end up spending more money than necessary. It's also not recommended that you take out a loan on your home, so a second mortgage or a home equity line of credit, to pay your medical bills. And this is because if you do that, you are turning what is unsecured debt into secured debt. And if you get into a position where you can't pay off that second mortgage or that home equity line of credit, you risk losing your home. Next slide, please. So while this cartoon might be a slight exaggeration, it can sometimes feel like this for people who are struggling to pay bills. And if anyone's on the phone, there's a man reading a letter that says, if you've already sent us your payment, please accept our apology for the death threat and warm wishes for the holiday season. So again, slightly exaggerated, but sometimes we can feel like that. Now, thanks to several legal reforms over the years, debtors have more rights when it comes to the behaviors of collection agencies. One of the protections is restricting when they can contact somebody in order to collect debt. So for example, a collection agency can only contact you between the hours of 8 a.m. and 9 p.m. So you can't be getting calls in the middle of the night asking for payments. There are also restrictions on who they can contact. So if you have an attorney that is helping you through any sort of bankruptcy or debt collection process, you can instruct that debt collector to make all contact through your attorney. And once you make that request, collectors can no longer have any direct contact with you. Now, other than contacting you or your attorneys, collectors are actually pretty limited on who else they can talk to about you and your debt. So they are only allowed to make inquiries that are necessary to determine where you live, what your phone number is, and where you work. So for example, if your current address, home address, is not known, the debt collector may be permitted to send one letter to your last known employer asking for your present address. But after that, they cannot harass your future or current employers for information about you. Also, collectors can't garnish federal benefits. So if you are receiving Social Security disability insurance, SSDI, or supplemental security income, SSI, or veterans benefits, those cannot be garnished in order to satisfy your debts. And if you have more questions about sort of debtor rights and what collection agencies are or aren't allowed to do, again, it's the Federal Trade Commission that is the federal entity that does this, and their website is ftc.gov. Next slide, please. So the next step in your path to healthy finances may be to look at your insurance portfolio for potential sources of income. So there are different types of insurance that you may have through your employer or that you purchased on your own that could provide some financial assistance. So the first is going to be disability insurance. Disability insurance is insurance that provides employees with some income while they're unable to work due to their medical condition. And there's a couple of different kinds. So there's federal, there's state, there's employer, there's private. And keep in mind when you're thinking about these disability policies that each type of disability insurance has a different definition of disability. Now you may be thinking, well, I'm already through treatment, so why is she talking about this? And the reason is because even if you've completed treatment, you may be experiencing side effects from treatment or have other medical conditions as a result of that treatment that are keeping you from being able to work. So if you have one of these plans, it might be beneficial for you moving forward. And you may be entitled to some retroactive benefits, even if you're already back at work. If you are back at work or you finish treatment, you might not be eligible for the two federal programs that I mentioned. But if you need to take time off from work moving forward because of side effects or an additional diagnosis or whatnot, these might be something to think about. Now, I mentioned the state disability programs because I know you are all over the country, but unfortunately there's only 6 states and territories that have short-term disability state policies. And these are California, Hawaii, New Jersey, New York, Rhode Island, and Puerto Rico. So if you live in one of those states, you might be eligible for additional state benefits. Now, do you have a disability or a supplemental health care policy through your employer or a private policy that you bought yourself? And these are going to be policies like MetLife or Aflac. I'm sure we've all seen the duck commercials. Some of these plans pay for certain benefits, which can give you additional sources of income. So again, even if you've completed treatment, you may be able to get reimbursed for things that you paid for while you were in treatment. So if you have one of these plans, we suggest contacting your insurance company or your employer's HR representative if you have it through your employer for more information. Now, the other type of insurance that might be beneficial is life insurance. So life insurance is a type of insurance that you can purchase to provide a beneficiary of your choice an amount of money in the event of your death. If you already have a life insurance policy and you need additional financial assistance, there may be some options for you. So we suggest asking or looking into your policy to find out if your policy allows you to borrow money from it if you have a disability. Or maybe their policy contains a waiver that's going to help pay your premiums for you while you're unable to work because of that disability. Or maybe something called a viatical settlement might make the most sense for you. So a viatical settlement is when you sell your life insurance policy to a third party, And typically, you're going to sell that policy for less than the full policy amount. Now, this might be helpful because you can get access to needed funds immediately. However, keep in mind that your original beneficiary will not receive anything from the life insurance policy if you do this. But there's some other options. So there's some companies out there that will provide you with loans using your life insurance policy as collateral. And one company that we know of is called Fifth Season Financial. And you can take a look at their products on their website. Next slide, please. So when looking for additional sources of funding, of course, financial assistance programs might be appropriate. And although the bulk of your cancer treatment is over, there still may be medications that you need to help manage side effects or other long-term medical conditions that you may experience. And some of these programs might help with these expenses or help with insurance. So of course there are the cancer organizations out there, like the amazing work that SAMFund is doing to help provide young adult survivors with financial support. And then there are some other groups like American Cancer Society, Leukemia and Lymphoma Society. But we urge you sort of to think outside the box when you're thinking about financial assistance options. So as a cancer survivor, you might be eligible for certain scholarships to help pay for higher education. So many of the divisions of ACS offer scholarships, and then there's organizations like Cancer for College or the National Collegiate Cancer Foundation. And I've included a website on the slide that has a pretty extensive list of scholarship opportunities that you might be eligible for. Now, this is also where we say don't underestimate the power of love. So your friends, families, neighbors, coworkers might be sources of financial help. They might not realize that just because your treatment has ended, you're not completely out of the woods financially. So consider setting up an online fundraiser through a website like Give Forward to help you raise money for medical bills or living expenses while you're still getting back on your feet after treatment. And of course, this is incredibly personal, but we hear so often from people saying to us, we wish we knew our loved one needed financial help and had set something up. We just didn't know how to help them. Think about it. How many times have you heard somebody say, if there's anything we can do, let us know? But it can be challenging to do that face-to-face. So programs like Give Forward can make that a little bit easier. Next slide, please. When looking for resources, again, you might have to think creatively. So maybe you can get assistance with your utility bills. So the money that you have set aside to pay your gas and your water can help pay for some of your healthcare costs. And there are resources out there to help with transportation and lodging and house cleaning and food and all sorts of other necessities. There are also some programs out there to help provide financial assistance with copays and healthcare premiums. Some of these programs are national, some are specific geographically, so they will only assist people in Michigan, or some are going to be cancer specific, so they only assist individuals with a certain type of cancer. And then there are also some organizations like Needy Meds or the Patient Access Network Foundation, which may be able to help you pay for your prescription drugs. So prescription drugs can be a huge financial burden for many survivors. And also, we urge you to think about pharmaceutical companies. So many pharmaceutical companies have programs to provide people who are having financial difficulties with their medications. Next slide, please. Now, the issue of paying student loans is often pertinent for young adults coping with cancer. And the good news is that some private student loan companies will allow you to create payment plans or change your payment plans, or even to postpone those plans through loan deferment or a forbearance process. Federal student loans also have a system to forgive loans if you have a if you qualify. And you can do that by having a permanent or total disability or meet all sorts of other types of criteria. And you can find more information at studentloanborrowerassistance.org. And then as a final note for student loans, some jobs offer loan repayment programs as part of their benefit packages. So if you are in a position to negotiate your benefit package with your employer, this might be something for you to consider. So maybe you will give up the contributions they're willing to make to a retirement plan or a life insurance plan if they're willing to then switch that contribution over to helping you pay your student loan. Again, all of these things are going to be things that you have to decide if they make sense for your personal situation. Next slide, please. Now, I focused on a lot of general things that you can do to rebuild your financial health, but I want to spend a few minutes narrowing back in on medical bills. As I've mentioned before, medical bills are a major concern for somebody who's been diagnosed. Now, these men are sitting on a park bench talking, and one says to the other, "My doctor told me to avoid any unnecessary stress, so I just didn't open his bill." Now, while this gentleman is taking perhaps an interesting coping strategy, it's not necessarily one that we would recommend, but there are a few things that you can do to reduce the burden of medical bills. Next slide, please. And I recognize that a lot of you are post-treatment, but I wanted to share these tips about lowering bills before care because they might be relevant for you for follow-up care that you might receive or just general future medical care that you'll have in the rest of your life. So you can, in fact, negotiate your hospital bills. Most hospitals have a billing department and even patient navigators that can help you with this. When it comes to getting lab work done, not all labs charge the same amount. So get a list of tests that your doctor is thinking about performing and actually shop around for lower prices. And this is going to be the same for any sorts of tests that you're going to have to get done. So MRIs, x-rays, etc. We also suggest grouping your appointments into as few a number as possible. And the benefit to that, in addition to not having to go to the doctor so many times, is that way you're going to only end up paying one copayment and one office visit fee. So that's going to be something that helps reduce costs in the long run. There also may be times when you can take a generic drug instead of a name brand, which is going to be less expensive. But of course, please make sure that this is not purely a financial decision and that you've adequately discussed the generic option with your doctor. And we also recommend that you just talk to your doctors or your healthcare providers about the costs. They might be thinking, you know, hey, this scan's a great idea, but if you are coming up on the end of your insurance year and you wait a month, that scan might be covered at a higher or lower rate. So talk to them about your concerns because they might be able to adjust your care accordingly. Next slide, please. Now, this is probably not a surprise to anybody, but for the sake of being thorough, I wanted to talk about it. So once you've received your care, you're probably going to get a ton of correspondence. So just from the insurance company, you could get 3 different pieces of mail, all at different times, and not necessarily always in this order. So generally, the first letter is going to be a letter from your insurance company saying, you've received your claim. Then you're going to get a letter saying, well, we're processing your claim. And then almost every insurance company will send out a letter called an explanation of benefits, or an EOB. And you can usually tell an EOB because it's going to say in large letters somewhere, this is not a bill. But it is still important for you to look carefully at this EOB because it's going to give you an idea of how much you're going to have to pay out of pocket. Now, these EOBs can be a bit challenging to decipher. There's usually a lot of information on one piece of paper, and it's not always written in the most clear manner. But there are a couple of websites that can help you decipher these EOBs that I've listed. And if you have questions about billing codes or the costs of things, or if it looks like there's a mistake, please, please, please call your insurance company and or your provider, depending on where you think the issue is. Now, the last piece of information you're going to get is going to be from your provider directly. So it could be from the hospital where you received care, it could be from your doctor's office, or it could be from a lab company you've never even heard of, but it happened to be the one where your provider sent your lab work. The amount written on this bill is going to be the amount that you are responsible for. but please don't take that at face value. Next slide. Because we strongly recommend reviewing your medical bills. Medical bills will likely keep arriving long after your treatment is over, and it's important to stay diligent and check your bills for accuracy. So if you believe a procedure or treatment should have been covered and it wasn't, you need to have a conversation about why it wasn't covered. Also, please keep in mind, medical billers are human beings, and human beings make mistakes. So it could be that something was added in twice. It could be that your doctor just wrote down that you got a scan, and they put in that you got an MRI and said you got an X-ray, and those are different costs. So just be diligent, and again, like anything else, you have to be sort of a aware consumer. Now, if there is something on your bill that you can't figure out with your provider or your doctor's office, and that you think is still inaccurate, you have the right to appeal that decision. So almost every insurance company has what's called an internal appeals process, and that's going to be different from company to company. But they have to provide you with information on how to appeal this internally. And thanks to the Affordable Care Act, all states are now required to have an external appeals process. So you may have to go through your entire internal appeals process first, and if you still aren't getting the result you're looking for, you can then go have an independent medical review externally done about this bill. If you have a situation where there's a lot of things that you are just not sure about, or you have extensive bills, you might want to consider talking with a professional bill reviewer or a medical claims organization. And so one example that we know of is called Med Claims Liaison. And they can actually help you go through and figure out if you've paid everything you needed to, or if you were overcharged for things. And generally how they are paid is they take a percentage of the money that you get back. And if you don't get back anything, they don't get paid. Next slide, please. Now, while a professional bill reviewer may be helpful, you should still try to create some sort of organizational system for your bills. And there are some systems that already exist that you can utilize, like the Cancer 101 Planner, or Livestrong has a survivorship notebook. I know people that do it all electronically. I know people that do it in 3-ring binders. So it doesn't matter. It just matters that you find a system that works for you and that you're going to continue using, because it's not helpful if you don't use it, right? Now, what are the kinds of things that you have to keep track of? You want to keep track of any EOBs and bills you get. Really, when you're communicating with your insurance company, you're going to want to take notes about who you spoke to and what the result was. But also keep in mind, you're going to want to keep track of other expenses related to your medical care. So things like meals and lodging. So did you have to travel outside of your state to get care? Did you have to make long-distance phone calls related to your medical care? And the reason it's important to keep track of those things is because some of those expenses might be deductible. So we're coming up on tax season in a couple of months, so try to pull that information together and be sure to mention these expenses to your tax preparer if you have one. And make sure that you keep a record if you are going to declare any of those items on your taxes in the event that you're audited. Next slide, please. So when you are dealing with medical bills, again, it is important to communicate with your healthcare team. So ask questions. How much generally do you think that this is going to cost? Is there a portion of this that might be able to be waived or written off? Many hospitals have social workers or navigators that can help you get through this process. And many insurance companies now also have people who can help you navigate this process called case managers. So again, the message here is just really ask around for resources. Don't be ashamed to ask for assistance, and keep asking until you get a good answer. Next slide, please. Now, the unfortunate reality is that even if you follow all of these steps that I've talked about, it may end up that bankruptcy is your only option, and you are not alone. So this slide shows a study that was done that found that of all of the bankruptcies in the United States, 62% of them were due to medical debt. And of those 62% of people who filed because of medical debt, 78% of them had health insurance. So if you find yourself in a situation where you are considering bankruptcy, I sort of tell people that they shouldn't feel bad about that, and that it's not saying anything about their level of responsibility or any of that. Next slide, please. So if you've already worked with a credit counseling agency, like I mentioned before, and you're still unable to negotiate or pay your medical bills or other bills, you may want to consider bankruptcy. If you are considering bankruptcy, you might want to consider contacting an attorney. Now, you can find reputable attorneys several different ways. So one way is through lawhelp.org, but also consider looking for your state or county bar associations, because many of them have lawyer referral services. And there's some tools that are online, like LegalZoom, where you can answer a few questions about your situation, and for a fee, you'll be matched with an attorney that can assist you. And this might be a really good option for people who don't have very complicated finances. But no matter which way you go to find an attorney, it's critical to become informed about the process and its effects on your credit report. So an individual may file bankruptcy under what's called Chapter 7, which is also sometimes referred to as a fresh start or liquidation bankruptcy. But bankruptcy is not free. The process is not free. So you can expect to pay in the ballpark of $2,500 to go through the bankruptcy process, and it can take anywhere from 4 to 6 months on average to get through the process. Now, also, please keep in mind that if you've recently filed for bankruptcy, you cannot file again for another 8 years. And unfortunately, there have been some rules that have made it more difficult to completely eliminate medical debt through bankruptcy. Next slide, please. So this slide just goes over the process, the general process of bankruptcy. And the first step is going to be finding an attorney, and they will likely give you a list of documents to gather. So it's going to be things like proof of income for your last 6 months, what are all of your assets out there, any taxes you filed for the last several years, and then you're going to sit down and draft your paperwork with your attorney. Almost every single state, because the bankruptcy process is a little bit different state to state, but almost every single state requires that you attend a pre-filing credit counseling course to figure out if there are steps that you can take to avoid bankruptcy. And then you're going to go through and figure out which assets are safe, which need to be filed with the court. You're going to have a short meeting with somebody who's called the United States trustee. And then finally, you're going to receive your discharge of debts from the bankruptcy court. Next slide, please. And there are some exceptions to what can be considered in bankruptcy. So there's something called a homestead exception. And again, this is going to vary state by state and marital status. But the basic concept is, if you have more equity in your home than the amount of your state's exemption, you will be forced to sell your home to pay off your other debts. So let's do an example really quickly. Let's say you have $25,000 in equity in your home, and your state's homestead exemption is $50,000. In that case, because it's less than the exemption, you might be able to keep your home. But if your equity is $150,000, the court is likely going to force the sale of your home so that that money can then be used to pay off your creditors. Now, there might be some other options, and again, this is going to vary state by state and situation by situation, so this is one of those things that you're going to want to talk to with your attorney about. Now, there's another exception for cars, and it's very similar to the houses. However, if you are behind on your car payments in a Chapter 7 proceeding, the lender that you have the loan with can actually repossess that car if you don't make all of the back payments. So keep that in mind. But if you own the car outright, you will likely not have to sell it in order to pay off your debt. Now, there's going to be some personal items of a nominal value, and again, state by state here, but generally small amounts of jewelry, animals, furniture, books, other small items that are personal. You're not going to be required to sell off everything you own to go through bankruptcy. And there might be some exemptions for pensions and retirement benefits as well. Now, if you have more expensive personal items like $50,000 watches or really valuable paintings, those are going to be things that you're going to have to disclose to the bankruptcy court, and then the bankruptcy court has the discretion as to force you to sell those items to pay off your creditors. But generally, you will always be allowed to keep what's called tools of the trade. So if you use something to do your job, they can't force you to sell that off. So a construction worker is not going to lose his tools or construction tools, even though they might be quite valuable, because he needs them to do his job. Next slide, please. So here's some final tips. Your credit cards are probably not going to be completely discharged in bankruptcy if it looks like you ran up the charges immediately before you filed for bankruptcy. So don't go buy that 50-inch TV right before Super Bowl Sunday and then expect to get that wiped out if you declare bankruptcy. There are also some debts that are going to be what's called non-dischargeable. So spouse or child support are not going to be discharged through bankruptcy. We'll still be responsible for that. Criminal fines, so parking tickets or moving violations, you're still going to be responsible for. And then the third category is going to be something that is really going to be case by case and at the discretion of the court. So some student loans or IRS taxes may or may not be dischargeable, and it's going to be at the discretion of the court again. So let's say that you have this huge student loan and you've been paying them back. You've been paying your bills on time for years, but because of this cancer diagnosis, you suddenly can't make those payments. That's going to lean more in the favor of you being able to discharge that debt. Next slide, please. So these are some mistakes to avoid, and generally what these come down to is don't lie or try to hide things from the bankruptcy court. So if you repay money to friends or family immediately before your bankruptcy, the court can in fact ask those people to pay it back. Don't hide creditors, don't try to transfer assets so that they're not considered, don't conceal assets, etc. Next slide, please. Now, because I know we went over a lot of information, want to tell you that there are some other resources out there that you can access. So Triage Cancer actually contributed a chapter to a free ebook at Thrive Survive that talks about these issues. And you can find all of these resources on our website, which is just triagecancer.org, and it's under the Resources tab. Next slide, please. And we also have some state-specific information. Can I get the next slide, please? So on our website, so if you go to the Resources tab, you'll see a map like this, and you can click on it, and there's the contact information for many of the state and federal agencies that might be useful for you to contact. Next slide. And I'm happy to take some questions in the few minutes that we have left, but I did want to give you guys our contact information. So if you're on social media, please feel free to engage with us. And then again, as Sam mentioned earlier, if there's questions that we can't get to, please feel free to send them in, and we will do our best to address them in blogs. So that's all I have.
That's great. Thank you so much. We do have,
we have a lot of questions,
yes, we do have a lot
so
of
we
questions.
will do our best. For those of you who ask questions, we'll do our best to get to at least a few of them in the next couple minutes. And again, anything that's not answered, excuse me, we will pass along to Monica, and she'll do her best to address them in a blog post later on. So
I actually made a little list here. So
great. Okay, go for it.
Yeah. So some of these are more applicable than others, so I'm going to start with the ones that are most applicable. We heard from one person who discovered that she was being charged 100 to 300% over the usual and customary treatment from her hospital when she got her bills, and she wants to know if there is anything she can do about that, if she has any sort of recourse. I guess the hospital representative she spoke to said that they're well within their rights to do that, and so I wasn't sure if you knew anything about the legality of that sort of behavior.
So unfortunately, hospitals and providers do have lots of leeway in terms of what they choose to charge individuals. However, I would say that that's pretty, that's a lot. So usually we don't see such vast amounts over the norm. So I would say that there's probably some legal aid organizations that might be interested in helping with that, and lawhelp.org might be a place to go to get some assistance. I would also contact your insurance company and find out if they're having similar problems with other people from that hospital.
Great, thank you. Somebody else had a question about the loan forgiveness. I guess it was her understanding that you can be taxed on loan forgiveness. Do you know if that's true, or how much, what the percentage generally is?
So to be perfectly honest, I don't know the answer to that question, as tax law is not my specialty, but I would say that that information should be given to you by whatever entity is forgiving your loan.
Got it. Okay. And there were a couple questions, again, that were sort of very specific, having to do with transfer of balances on credit cards and maintaining lower interest rates. I'm assuming that's also not necessarily your area of expertise. I didn't know if there was a resource that you knew of that would be helpful in answering questions like that.
Sure. So generally, here's what I would say about that. I would say many credit card companies will lower interest rates if you ask, especially if you've been a good consumer up until this point. So if you've always paid all of your bills on time and you've been with a credit card company for a long time, calling them and asking them for a lower interest rate and mentioning that you've gone through a serious health situation, they are likely to lower those interest rates. Now, in terms of transferring credit balances, it can seem very attractive to go to one of those, 0% interest on all transfer balances. And if you are in a situation where when you transfer that balance, you can then pay off the balance before that introductory period ends, by all means, that might be something that makes a lot of sense for you to do. However, what we see quite often is people transfer the balance, and that's great for the first 12 months or whatever that period is, but as soon as, and it depends on the card, but if you can't pay the full amount by the time that that introductory period ends, you will still be responsible for the entire amount of back interest. So it can sort of be a trap, but it can also be a very useful tool if you are in the position to pay off the whole balance within that introductory period.
That is good to know. I think the last question I'm seeing here from a woman who said her husband is the insurance holder and his name was put on a debt on both of our credit reports. Is there a way she can remove his name from that debt if she's the one who was treated? He was not.
So I would contact the credit agency and find out why they're reporting it that way. It might just be that they're reporting it that way because he is in fact the account holder on that. So again, that's going to be a little bit different depending on the insurance company and why. So it might be that it was reported to the credit agency incorrectly, that it was his debt and not hers.
Okay. Great. I think that may have been all of the sort of relevant questions here. I think you were able to answer them, which is great.
Excellent. Well, thank you so much, Monica. I know on behalf of everyone who's participated and everyone who's going to listen to this, we just all really appreciate all of the expertise and information that you're willing to share. So thank you so, so much for this incredibly helpful webinar.
Thank you for having me.
So again, Triage Cancer's website is triagecancer.org, and we invite you all to visit their website really regarding any of these issues that you may be facing. There's a wealth of information, resources, tips, and advice on their site. So definitely take a few minutes if you're struggling and need some more information to go over to their website. Anyone who may have missed part of today's webinar, or again, if you know anybody who wasn't able to participate but could benefit from the information, check back on our website in a couple days, the samfund.org/webinar, to listen to the recording of this webinar. And again, if you would just take a couple minutes to complete the post-webinar survey, there's a bit.ly link, which we know is not at all user-friendly or memorable. So just write it down. We're very sorry. It's bit.ly.
We're going to email it to you as well.
Yes. MPEOKN, but it'll be emailed to you. And we really do value your feedback. We really want to know if this was helpful to you, what we could have done differently, and most importantly, if there are other things that you're struggling with as a result of your cancer, please let us know, and we'll do our very best to develop a webinar presentation that will be helpful to you. So you can let us know in the webinar survey. You can send us an email at webinars@thesamfund.org, and hopefully we will be hearing from you soon. Thanks so much.
And for anyone listening to this after the fact, please go ahead and fill out that post-webinar survey as well. It does not have to be just folks who are listening to it live. So we appreciate all your feedback.
Absolutely. Thanks so much, everybody. Have a great rest of the day.